Great job, Tosin. You can see how much fun she is to work with. It's amazing. And she... So I guess Tosin kind of picked on the senior doctor to summate, and that would be me. Sometimes I'm called grandpa in the practice, but somebody else said, no, you should be the patriarch. And I went, yeah, I kind of like that better. But I am a grandpa now, so I am happy about that part. So I think, I forgot to ask Michelle, I think this is recorded, right? So if somebody wanted to listen to this later, can they? Is that right? So it'll be on the GRF website at some point? Good. So, if you forget a few fine points, you can go back and listen to the recording, which is always great. But, someone earlier said that glaucoma is a team sport. And I thought about that and I went, wow, that's really important, because what does that mean to me and what should it mean to you? And it means we're all in this together. We really are. And that's why you're here. And that's why this is actually my first patient glaucoma patient summit. It's my first. And like Dr. Butler said, she didn't even know about it earlier when she gave her talk. So, we're all busy, we're all living our own little silos, but it doesn't mean we can't peek out and learn. So why is this really unique to me? Because I was always taught that patients are our best long-term teachers. And, if you give some space, like Dr. Smith was mentioning earlier, and you're listening in the clinic, then you can learn a lot that's not in the textbooks. And, I'm starting my 42nd year, so I've seen some patients, they're 40, now they're, 82. So I've been with them through the whole journey. So you learn many valuable things that really aren't in the books. So if you look at it from a patient perspective, you've heard lots of stories and journeys. And that is incredibly valuable. So some of these journeys that you heard today, not just from patients, but you got to hear journeys from a clinician scientist. So you got to hear things on a cellular level, and then they took it to kale and exercise. So this is really unique, but it gives you a little more perspective about what, for example, Dr. Frankfurt was talking about on a cellular level, trying to figure out what's happening to the retinal ganglion cells, what really is happening at a cellular level. And here we are, at a totally different level. And then we heard about mindfulness and all these things that maybe we should be doing differently. So we heard a lot of recurrent themes. But I was really impressed by a couple of things. So when I heard Carolyn speak this morning, who actually kind of kicked off the meeting, one of the first things that she said was compliance was really important. And I found that really interesting because, well, you heard Dr. Butler say, our compliance with the medications is not very good, that the refill on the medication rates is terrible. So why is that? But that's a whole other story. But you heard about some of the problems related to it. But compliance is one of the first things Caroline mentioned. I thought that was interesting because you heard Diana Younger here earlier talk, and I asked her to come to this meeting because, she's a trained psychologist who teaches and she's retired now, but she taught at UT in the Permian Basin. And I went, wow, I bet I can learn something from her. And interestingly, and I talked to her about this a couple of weeks ago, and I actually conned her into coming to this meeting. I said, you have to come and share your knowledge. And one of the first things she mentioned as well was compliance. And I went, wow. So I was listening to her, and she said, Dr. Fellman, I asked her, what did you teach in psychology? And she said, positivity. And I went, wow, we need some positivity in the glaucoma clinic. It's tough. And I said, so at the beginning of the exam, before I looked at her, I said, I want you to give me one word that you can tell me at the end of my exam that helps you with that, with positivity. And who remembers what she said? Gratitude. I went, wow, gratitude. That's okay. And then I emailed her and said, I really want you to come talk at the Glaucoma Patient Summit. And she wrote me, and I asked her, I said, what are the most important things that you've learned about dealing with glaucoma over 50 years? You've had glaucoma 50 years, and you're a trained psychologist, you have the background in this. And she mentioned the three things to me. So I told you the first. She said compliance. I went, okay. And then I learned from her that compliance leads to hope for the future. But you have to have the positivity and the gratitude to that's a springboard, I think, to get to the compliance. But somehow the compliance, we all need to we heard Clay talk about, Clay Robinson, he talked about reframing ourselves. So somehow we have to do a better job of reframing ourselves to think about these, I think, three key things. So we mentioned compliance, and we mentioned the springboard to that, but somehow compliance leads to hope for the future. And that's what, a trained psychologist was trying to show me is important in a glaucoma patient's life, and how we need to probably, and I love that word that Clay talked about, reframe. We need to reframe ourselves to think about that. And then she said, that all ties into joy in the present. So how do we get to that? We have compliance, that's the springboard to get us to hope for the future. And you heard about, for example, the work the clinician scientists are doing on trying to regenerate the optic nerve. That is for real. We've involved in some of those studies. I've seen some of it. So, it's not false hope. But it takes a lot of incredible work to get there. But somehow that leads to the springboard, which is joy in the present. So somehow we need to reframe ourselves, I think, to think about that. And this is the kind of meeting that it happens, right here. We all know how we can maybe make things better. Now, we heard about, journaling and mindfulness and all these things. I certainly know zero about most of those. But I'm going to learn, because I think that it can make a difference maybe for my patients. So that's what that's what the summit's about to me. Patients are our best lifetime teachers. You can go back on the Glaucoma Research Foundation site and listen to the whole meeting, and you'll learn. And I'm sure you took notes. And you had lots of great panel discussions and asking your questions. And it's unique in that we got to do that. But the last thing I'll leave you with is what Diana Younger said when she was up here on the panel. She said, humans like to help each other. So let's do that. Thank you.